are indeed in the makings of something beautiful and new, creating novel CBD formulations. And I'm going to introduce our panelists, and then I'm going to do my best to stay out of the way. On the far left, we have Dr. Janelle Kim, co-founder and lead formulator at JBK Wellness Labs, a contracting manufacturing company. And she has her doctorate of acupuncture and Chinese medicine and traditional Oriental medicine. In the middle, we have Mr. Chris Cooper, founder and CEO of Lucent Laboratories, and founder and CEO of Black Medicine, also has a master's in science of applied physics. Now on the end, we have Sitza Elsinga, who is chief science officer at The Workshop. He has his Master of Science in Natural Products from Leiden University and serves on the USP subcommittee on cannabis contaminants. So thank you all for coming. So I would like to start with a question here. What novel or uncommon CBD preparations are you excited about at this point? So it's open, wide open. Anybody can answer.
What novel products? Okay, would you like me to begin?
Or uncommon. They don't have to be totally unique.
Uncommon. Well, I feel like, as Ezra just shared, we're a custom manufacturer. About 20 years ago, we got into the space, and that space was creating all natural, luxury herbal products, right? Particularly in the high-end spa and retail industries. So the interesting part about that, I find, is that this was during a time, if you can even imagine, that natural products were not the thing. It's really hard to imagine. And so we kind of were on the forefront of that. And so there's so many limitless possibilities, and even 20 years later, I find that to be the case. I come from a lineage of herbal medicine, and that's who I am first. Even in the CBD industry, I like to say I'm an herbal doctor first. And something I always love to remind all of us is, please remember that cannabis, CBD, cannabis, has been in Chinese medicine for over 4,000 years. And I love saying that and always reminding myself of that as well, kind of grounding us in that. I find that I hope that it takes a lot of uncertainty away for people, because it's not something that was just created. We have, in answering the question, I truly believe that the possibilities of products is limitless. It's my favorite thing. I sleep, eat, and breathe it. You can ask my husband and partner, Craig. 3 in the morning, I'm like, okay, I have an idea. He's like, just go to bed. No. Right? But ultimately, it's endless. In skincare, body care, dietary supplements, muscle and joint health, detox, calming. And so I love this panel, and then I'm going to stop talking here, because that's something we've done from the beginning, is utilize the understanding of herbal medicine to create functional type of products, novel products. And so I'm so happy that this is a topic for today.
And talking about herbal products, everyone is always talking about CBD, but the cannabis plant doesn't really make CBD. The plant makes CBD acid. Right. And what you see now is, I noticed one of the companies here specializes in CBD acid. So you finally see this compound hit the market, and it's relatively unexplored. So it's going to be interesting to see what kind of properties it has. And properties like anti-inflammatory are very likely. THC acid is a very strong anti-inflammatory compound. So yeah.
I think using CBDA, for example, and also some of the other cannabinoids that we've been looking at, like CBG, combined with the terpenes, really has a lot of potential. What we've been doing at Lucent Botanicals for the last year is we make mints, and different varieties of mints targeted at different effects. So they sort of start with the base of CBD and add terpenes and herbs to create the functional effects that we're looking for and that everybody's trying to achieve. And it's, I think, however, that you're going to see more and more of that. It's still a little bit rare in the industry, but it's a little more cutting edge, and you're going to see more and more companies trying to achieve a little closer alignment with the effects that their customers are trying to get for themselves.
Mm-hmm.
Thank you very much. So we did hear, especially if anybody was in the last panel, we heard a lot about the entourage effect. So I want to hear, what are the advantages and potentially drawbacks of using CBD isolate as opposed to a more inclusive cannabis extract?
I'll speak about that because I have a very particular point of view that probably isn't well adopted or agreed to by many in the industry. We use isolate in all of our products, and we add terpenes to them. And the reason for not using full spectrum or broad spectrum is that in this fashion we have a lot more control over the terpenes, their proportions, and the ones that are added. If you take a full spectrum product, you have very little control over the cannabinoids and the terpenes that are in that product. Except if you change from strain to strain. It also varies from season to season or crop to crop. It's a lot harder to come up with a consistent product that has the right proportions of terpenes and maybe other cannabinoids to target the effects that you want. So, for example, some strains may be very heavy in myrcene, but that's, while appropriate for a product that is meant to calm or to help you sleep, it's certainly inappropriate for a product that is meant to provide energy or greater focus or something like that. And when you are just using one strain of a full spectrum CBD or hemp plant, it's sort of impossible to have any control over what goes into your products.
And that ties into building a brand, of course, because why is McDonald's so successful? No matter where in the world you go to, when you order a Big Mac, you know exactly what you're going to be getting. So if you cannot standardize your product, you cannot deliver consistent, reproducible effects. So yeah, starting with CBD isolate and reintroducing the other constituents makes sense to me.
My favorite thing is this type of a panel, and I truly appreciate the points that you gentlemen just brought up. Now, of course, as an herbologist, I can now maybe go into the other perspective, because the truth of the matter is, I believe you answered that beautifully. There are certainly times in our lab we formulate with isolate. And even from a formulation standpoint, there's some products that just in order to, as simple as being stable, remaining stable, you have to use isolate, and there's other reasons out there as well. From an herbologist standpoint, of course, the entourage effect, the full spectrum, broad spectrum, if you were to ask me, Janelle, what's the most healing effective, not looking at the whole picture, but just that one question, of course I will answer that the most effective, or Dr. Stuart Titus, who many of you might know, who I work with very commonly, we will answer to you. Full spectrum is always going to have the most healing benefits, because that's the plant in its true nature. I love to give an example of this, and there's certainly times where having more control, getting directly to an end result that you wish for, that is absolutely appropriate and the correct thing to do. As my mentor taught me in life, when to do it and when not to do, right? And that applies to everything, including formulation. And that's the job of the formulator. Interestingly, another herb that I love to visualize this way that shows this kind of effect, and used maybe, which will be my next step, why it's so important to make a macrocosm of this understanding of the entourage effect in formulation, because that's where it's the most important. You have an herb called ephedra, right? That herb in Chinese medicine is called ma huang. That herb is an incredible herbal ingredient as a whole to create asthma, even for children. But now there's a company who took that, in an interesting way, on the other flip side, they took out the constituent ephedra, right? And they created Metabolife. And now all of a sudden, so many people were harmed by this ingredient being broken down in a way that was not balanced, and the herb was taken off the market. So we couldn't use one of the most powerful herbs in our materia medica for treating asthma because of this. So it's so important to understand that, but taking it one step further, if I may, it's also the understanding, I love to talk about entourage effect within one ingredient, but also in formulation, and I think that's where it's the most important. As you just shared, Chris, breaking it down, but then adding in certain terpenes or essential oils or other botanicals that now create a balanced type formula, because that is the most important thing, and that's what I love to
and don't forget other cannabinoids, because finally
absolutely
that starts to happen too. Finally,
that's
you see
right.
companies that produce other cannabinoids than
Right.
CBD and THC, which
Right.
were the ones that we pretty much, the only ones we saw up until this year.
Right, yes, most
Yeah,
definitely.
so I think you will be definitely seeing more products with, maybe they'll start from isolate and add in CBG or CBN or some of the other cannabinoids in addition to the terpenes and to the herbs, and that's the job of the formulator.
I love
is
what you said,
to-
that it's the experts.
Is to really
yes.
put together something that works with some synergy.
And Chris, you took the words out of my mouth, and Ezra is there, so I think I can keep going with this a little bit. I love that you said that, Chris. To me, that's the most important thing. You know, when I speak of herbal medicine, with all due respect, does not mean taking whatever herbs you think and putting them into a formula, right? Each herb has their incredible functions, but when you create a formulation, every single herb matters. The dosage, the precision of understanding that ingredient, depending on the season, on the climate, where it comes from in the universe, and then creating a proper formula, as you just said, that synergistically combines together, and that's where you create an effective formula. And that's something really important when you're creating a line, if I may say so, as a doctor and practitioner first and formulator, is that it's so important to go to an expert and a formulator if you truly want an effective, safe, you know, the best product possible, because understanding how to formulate that properly is the key to not harming your end consumer and being the most effective.
Thank you very much. It's interesting you mentioned the mahuang root. I'm not mistaken, that's the grandfather of amphetamines.
Yes,
and
that's
so
exactly
they
right.
took that ephedra out and they added a couple atoms and talk about unbalanced.
Yes.
So, can you speak to the effectiveness of CBD or the potential of effectiveness with CBD with various terpenes?
I can only, I'll tell you how I made the formulations for our product. Having read some of the literature, understanding that terpenes in general were important and could provide a lot of different effects, I then started looking at the scientific research and also scanning a lot of the anecdotal information that's out there on the web about what effects different terpenes have. So it is still, I would have to say, in its infancy, and it's hard to get a lot of information. There's enough to give you some general guidelines to go on, and what I did was I put together my formulations based on what I could pick up from the literature, and then since they are very safe compounds and it's very little risk of overdose or any negative effects, it's possible to get your customers to experiment, basically.
Yeah, almost every plant. I mean, some people think that terpenes are specific to cannabis, and because that's the connection that most people have heard it in. But terpenes are in any fruit and most vegetables.
Mm-hmm.
So yeah, they're very generic compounds.
Mm-hmm.
Yeah, and all the terpenes that we use, well, it's very expensive if you want to extract your terpenes from cannabis and then put them back into your product. So we use terpenes which are equivalent chemically, but they're of botanical origin. So, for example, limonene comes from orange peels and so on.
Plus, they smell nice. That's it.
Absolutely.
I think that's the point. I saw some post on Instagram. Somebody was like, "Man, this dessert is delicious. I love these terps." But it's not inaccurate. I mean, it's certainly not every aromatic hydrocarbon out there, but certainly very prevalent. So, a similar question: can you speak to the effectiveness, or again, potential of effectiveness of CBD with other cannabinoids?
Well, yeah, CBD. We have many different cannabinoids, and as I said earlier, like finally we see these other cannabinoids become available, because people talk about full spectrum and they say like, yeah, there's 130 different cannabinoids in cannabis, but in reality, when you actually measure the plants, like you only see about 8 different ones. The other ones are just not there, and the other ones that are there are just present in trace amounts. But scientists have isolated all these individual components and have screened them for the various receptors. And all these compounds have different binding affinities to a whole range of different receptors. And how these all interact and connect with each other is not completely known, but we know that all of them contribute and do something. And as these other cannabinoids become available, we can make novel combinations that will result in novel clinical effects.
So I haven't made any products with combined cannabinoids in them. So right now it's CBD plus the isolate plus the terpenes. And the difficulty in there, if I want to, for example, add CBDA or CBG or something else, the difficulty if you're a manufacturer, of course, is sourcing. and finding products that are, number one, reliable and clean, but two, can be provided in quantity. And that is only just now, I think, starting to become possible. So I think it's possible for us to find a few suppliers that are able to create the products that are of interest and start doing experiments with them. But I think there are very few products out there that combine in a purposeful way certain cannabinoids. You can get them, of course, mixed if you're doing full spectrum or broad spectrum, but you don't have any control over the proportions, the relative proportions.
I'd say so.
Thank you for that. So we know that there was prevalent use of cannabis extracts in the last century or so, but predating that, can you speak to any use preceding modern medicine with regard to cannabis in medicines that way?
Absolutely, I can. Not to get into too much detail, but for example, as I previously mentioned, because I do think that's so important, in 27 approximately, right? Because they didn't write these things down and record them in the way that we know at the time. In 2737 BCE, that long ago, 4,000 years ago, there was a doctor. He was called, in Eastern medicine, he's called the divine farmer. Really interesting, right? And so he was the one way back then that really started some of the most important medical texts, classics, that really at this point in time, which I love, are throughout the world. They're studied in all medical schools, including Harvard, your Stanfords, because we're all understanding there's so much to gain from all of this. At that time, that long ago, and it traveled through oral tradition, which I know very well because that's exactly how the formulas in my family have that lineage. It's sometimes hard for this society to grasp, but I think we all find it very interesting and easy to understand. Way back then, he found that cannabis was very good for nausea, vomiting, for certain skin conditions, right? For seizures, for epilepsy. He may have described it differently. They say calming the mind, calming the body, which I actually love those types of ways of describing because it's so accurate, right? And that is why they have some of these effects that we still see to this day. And so certainly, that comes sometimes when I'll give lectures, whether it be skincare or dietary supplements. I always like to state, because I think it's very interesting to grasp onto, what are some of the main properties of CBD? And I love to say, as you already said, one of them is anti-inflammatory. That's been known through time. You have your nourishing and supplementing. You had mentioned actually, Chris, that it's a very powerful ingredient with very few side effects. That's really important. In Eastern medicine, it's known as a superior herb. That is very powerful when you understand what that means. And in short, also in that category is ginseng root. Also in that category is astragalus. These are some powerful ingredients that I'm speaking of here. Superior herbs are just that. They are the powerful ingredients that are very easy on your body, which is so important. Okay, and then, so anti-inflammatory, we have antioxidant, right? Antioxidant benefits. On some level, what is more important than that in this day and age? Antioxidants help to fight the free radicals. That means we're human. We can't avoid anything that we come in contact to some extent, right? We can't avoid it, but we can learn how to balance with that and protect ourselves with that. And CBD is a very powerful ingredient as an antioxidant. Again, whether it's in your skincare, whether it's in your vitamins, whether it's in your muscle and joint products, your sleeping products, because it helps to create that barrier, that protective nature for you. So.
Thank you. And I don't know if you guys, if I can add, I don't know if you guys recall, there was this most complete Iceman found in a melting glacier, and they, among other things, they determined he was a medicine man, and they found, among other things, nearly 2 pounds of cannabis on him. So apparently it is.
Yeah, he had a whole bunch of psychoactive herbs.
Yeah, very, very important. Yeah. That guy was probably really cool to hang out with.
Yeah.
Okay, do we have audience questions? Don't be shy.
He answered everything.
We do have some more questions, but I want to make sure we get to audience member questions. Okay, so the question is, if we are isolating individual cannabinoids what happens to these formulations. And I'd like to sort of refer back to sort of a question we already answered. The question before was, what are the drawbacks and what are the advantages of isolate?
Do you mean from a, yeah, so you mean from a legal perspective that it's not hemp oil anymore? Now it's so the hemp farm bill actually allows for any derivative products. So the hemp farm bill sort of covered all that.
But it's fair to say that we're all sort of in a legally murky business right now anyway, until things are really cleared up by the FDA.
Yeah, and I think that the pharmaceutical industry doing what it does would attack specific individual molecule targets.
Yeah, and also the FDA has made multiple statements now and inquiring requests for comments, and it really seems like they realize that the genie is out of the bottle and there's no way to jam it back in. So I do expect that within the next couple of years, unfortunately, government moves really, really slow, but we will see some way to allow CBD as a dietary supplement.
Okay, we had 2 questions right up here, so let me start on the left.
So my question was, there's a large number of CBD companies that already exist. My question is, how different are these formulations between companies? Can we really point to, a tincture that says, this is 1,000 milligrams CBD? Is that really a novel
Yeah,
formulation?
that's a fair question.
This full spectrum,
Yeah.
would they include in that, or?
Well, yeah, so 1,000 milligrams in one bottle is definitely not the same as 1,000 milligrams in the other bottle. That can matter, that can have a huge difference, especially with whole plants extracts. And we have seen that in children with epilepsy, that the parents shifted from one manufacturer to the other, and all of a sudden the systems returned. And I run an analytical lab as well, so we knew that it had the same amount of CBD. So sometimes there are other factors that come into play. And then in general, we see, for example, in the case of epilepsy, that a little bit of THC being present tends to make the product more effective.
I can certainly, I'm sorry.
Then I guess that kind of ties into, the anecdote, CBD, THC affects everyone different because they're at the same dose. So if I take 10 milligrams THC, it's going to affect me differently than it does you.
Yeah, but the difficult part is that what you see on the market from, honestly, hundreds of different suppliers is, here's CBD, here's a tincture of CBD. And there is very little that the companies will even put out which suggests what it's really good for. And maybe it is good for calming, or maybe it's good for epilepsy, but they don't tell you anything about the strain and why different companies' strain is more appropriate, or even a different product from the same company. They generally don't have that.
So and I think this is where you as a company can set yourself apart by doing some small scale studies, have them run by independent people, and really provide data to back up anything you say. Although you have to be really careful, you can of course never make medicinal claims, but you can, there are some options there.
You just had a lot of topics. My mind's like blowing because I'm trying to remember all the things that you brought up. Some very good points. To answer your first question, that is exactly what we do. Interestingly, even with Ezra earlier, which is totally understandable. This happens all the time. Okay, Janelle, so you're a white label, private label company. Well, the answer is no. And in fact, I think there's a panel that my husband and partner will be on. What is the difference? Which is a very good question. We are a custom manufacturer, which means every single product that we make is custom to that client. And we have done that. We've worked with the pioneers in the industry as they're known today since 2012. And from the very beginning, that's something that was very important to us. And the only way that we would work with these people at the time, because that's what we stand true to at our lab, meaning we are an herbal company first. Why I say that is that even in the beginning, in order to create the way that I understand according to herbal formulation, truly functional products, whether it be your skincare line, your cleanser to your moisturizer, there's things you have to do to make a cleanse and a moisturizer. I gave those 3 points about CBD, and that can fit all across the board, which is principally very important when creating a good product. But you combine other ingredients to create that beautiful formula that I first spoke about, and I love that word beautiful, because that's what it is, it's an art, right? And so to answer your question, we have clients ranging from your Four Seasons, Ritz-Carlton, and Nordstrom's, Neiman Marcus, Bergdorf, to Whole Foods, to CVS, to Kroger, for muscle and joint products, to skincare, and the difference is why people come to the experts to formulate, for example, is to understand that how to achieve effective functional products, right? And so that's so important. Then when you said it affects every person differently, that is such an important piece, regardless of any industry or anything we talk about, just the understanding of the human body, which is vital for all of us. When we talked about the endocannabinoid system, the ultimate key is homeostasis. That's something in Chinese medicine I've been trying to get across for so long, and I love that this now comes up. But it's so important to know, as the person developing and as the person taking it, every single one of us is different. So why does it affect us differently? Right now, I am different than I will be later this evening. I am certainly different, my condition, than yours. And so when you're trying to achieve balance and you have the proper formulations to do so, in that moment, that powerful ingredient, that powerful formula should have the ability, just like a whole bunch of, I like to say, like practitioners or doctors going inside to fix what's wrong in that moment. That is balance and homeostasis. And that's the beauty of it all. And so while I highly respect and think it's so important to have standardization of certain things, I also, east-west, right? Old, new, think it's so important to understand that true balance of your condition will always need different aspects. So,
Thank you. And if I can add, is my mic still on? No.
do you want to
Okay.
take this one, Ezra?
No, I just turned it back on. If I can add analytical information on your sources is very important, and that can be a differentiator, because there are going to be some contaminated CBD sources. I was once sourcing CBD for a consulting client, and I said, well, do you have any analytical data? And you'd think it was the periodic table, because what they were doing was using that hemp to remediate a nuclear waste site. And so there was chromium, cadmium, iodine, all these, nuclear decomposition products, the metals. Cannabis is very good at pulling metals out of the ground. So get and trust, but verify. So get that data, and then also, seek an independent lab source, especially if you're going to be sharing it with people
And if
who are
I
sick.
may say, which I'm sure we all will agree upon, there's certain things that even, in 2012, when people didn't even understand really what CBD was, there's certain things as a lab, a manufacturing lab of any kind, will have in place or will be working on or will be important to them, which is things you can look for, your lab following CGMP guidelines, current good manufacturing practices, right? When you're dealing with dietary supplements, that you're, registered properly with your health departments or FDA, so on and so forth. So these are things for certain products, that are, like I said, dietary supplement aspect, it's important. Those are kind of some things you can look out for. I don't know.
And even with a whole plant extract, there are ways to standardize. For example, Epidiolex, which is a registered pharmaceutical by GW Pharma, is not pure CBD. It is a whole plant extract. And even though they don't know exactly 100% of every single component that's in there, they have found a statistical way, and the company Chemometrics, they're called, does that for them, to make sure that they measure the whole extract, and they monitor for certain peaks and make sure that everything is always the same, even though they might not 100% be certain what every single peak is. So you can standardize a whole plant extract as well.
Okay, I'd like to move on to the next question. The gentleman over here. Yeah.
Based on the legal landscape that we all are, and just adding to the two questions before, what would be then the correct way to solve the formula and the lab from the CBD from? Would be herbal? Would be cosmetic? Would be medicinal? What would you
Sure. Okay, so just to rephrase your question, how do you label the product in the current legal climate?
Yeah. So the American Herbal Product Association would be a really good resource to turn to, but their their position is that you cannot make any claims regarding CBD content. Yeah, but you can say it contains hemp oil, and you can say X amount of milligrams of hemp oil, but they suggest that you do not state CBD specifically, because CBD, according to the FDA, is a pharmaceutical product, because GW Pharma filed an investigative new drug file before anyone gave them notice that this is a commonly used ingredient in the food supply chain, and therefore it is, according to the FDA, a pharmaceutical ingredient, and therefore it cannot be present in any consumer product. Cosmetics are maybe the only consumption, because technically that's not a food product.
We sell our mints as dietary supplements, and of course we tell people that there is CBD in them. We put it on the label and on the box, and we butt up against potential regulatory issues.
Yeah, and in reality, you don't see any action unless you start making medicinal claims.
Yeah, and we don't make medicinal claims, but we make mints. We could have marketed them as edibles, for example, as a food, but we felt it was a little more realistic and better for our market to market them as dietary supplements.
Yeah, then you're in a real
Yeah.
hot
Yeah,
mess
then you
of
can
trouble.
expect a warning
Yeah.
letter. Yeah.
Yeah, you cannot make medical claims because it's now you've made an enemy out of the FDA.
And they have sent out a number of warning letters recently, and they're usually meant to make an example, and hopefully they hope that other companies will fall in line and pay attention. And not
Surprisingly
make the same
though, there seems to be very little follow-up.
Yeah.
So, for example, there's a company called Pain DMSO. They were one of the first companies to receive a letter. I think it's about 4 years ago by now. Their website's still up and running and selling products. So, I don't know exactly what the FDA does, but they don't seem to yeah.
And
There's-
probably the key point there is it's called pain. That's probably not the best thing to do if you're.
Oh yeah, no, they make claims about cancer
Yeah,
and everything.
right away.
It's
I'm not speaking of the
shocking.
company, I don't know, but certainly don't make your website pain, because that's probably a good idea.
Well, and if you're going to break the law, do it fast and hard so you make enough money to pay for lawyers,
Oh, goodness.
right? That's a joke, just so that everybody's clear. I'm not advising that anybody break the law. You had a question?
You guys are all in manufacturing. Have you done any research about the compounding effect of different routes of administration? For instance, I know CBD is absolutely barrier, right? Sometimes dehydration, sometimes lower blood pressure, depending on your condition and all of that. What if you're using a tincture and then you have other routes of administration, like the topical, or you're ingesting a long Have you done, are there compounding?
Well, there are metabolomic studies, pharmacokinetic studies about CBD, and what you see, it's kind of interesting because everyone always talks about CBD, but just like THC, when you consume it orally, most of the CBD gets metabolized by your liver into 11-hydroxy-CBD. So what you actually measure in your blood is not CBD, it's 11-hydroxy-CBD. When you inhale it, it's a different story. Then you find actual CBD in your bloodstream. And so it's important when you look at animal studies and things like that to look at the route of administration. If they injected it in the bloodstream, that was CBD. If they gave it orally, most likely it was an 11-hydroxy-CBD.
So are you getting a compounding effect if you're doing, two routes of administration? Somebody who takes a daily tincture, for instance, and then uses the topical nightly.
Yeah, I mean, topicals.
Seems feasible,
Yeah.
but
Yeah.
we haven't done any testing.
I mean, I did a personal study when I ate an edible and smoked a joint, and I was higher than I could possibly manage. So, from an anecdotal standpoint,